graduated summa cum laude from the University of Maine with a Bachelor of Science degree in microbiology and minors in chemistry and psychology. During her college career, she was a teaching assistant for the organic chemistry and microbiology labs, a volunteer EMT for the University Ambulance Service, and a leader for the community service organization Alternative Breaks. She was the recipient of several scholarships, including a scholarship for academic excellence in microbiology and a Servant Heart Scholarship awarded to students who demonstrate commitment to community service. Following graduation, Kate worked as an emergency department technician at a trauma center in Maine. While her experience in patient care encouraged her enthusiasm for medicine, Kate ultimately realized that her true passion was in laboratory science. Please welcome Kate McKean.
Hello everyone, and welcome to our MLS graduation ceremony. So, when I was in grade school, there was a phenomenon that occurred quite frequently. We would be sitting in class, listening to the teacher speak, and without fail, one of my peers would raise their hand, and they would ask the teacher in an exasperated tone, "Why do we have to learn this?" And at the time, I was pretty convinced that the only reason a student would ask a question like that was because it was their way of announcing their displeasure about having to be in class. However, when I reflected upon this question later in life, I came to believe that it meant something different. I think the question, "Why do we have to learn this?" does reflect a genuine desire from students to understand the applications of our education. Students want to know the reasons why we learn something, its importance, and how we'll use it. Especially considering the immense amount of time and effort and financial burden that being a student now demands, it becomes impossible to wonder, will any of this information actually be used in my future career? One of the most amazing things about Mayo Clinic's MLS program has been witnessing just how much of our MLS education is utilized and relevant in the clinical laboratory. But let's actually take a moment to appreciate the amount of knowledge that we've learned here. We have learned a whole range of blood disorders, the names, characteristics, and disease states of bacteria, fungi, viruses, and parasites, the constituents of body fluids, the reference ranges and implications of numerous analytes, the characteristics and frequencies of red blood cell antigens, the factors that affect bleeding and clotting, not to mention the laboratory testing specifics that go along with all of these sciences, and on and on and on, so much more that I could possibly begin to summarize in a 5-minute speech. But what is so remarkable is that when we rotated through Mayo's laboratories, we found that most, if not all of this information is used. In fact, it is not only used, it is essential. The collection of knowledge that we've learned here allows us to look at a single result and declare with confidence and accuracy what is going on with a patient. That is an incredible capability and a commendable accomplishment. The knowledge that we have learned here is information that we will use every day, and it will allow us to be outstanding laboratory scientists. However, in order to truly fulfill our role as MLS, there's something else we must do. We must remain mindful of who we're using our knowledge for, and that is for our patients. Most of us here won't interact with patients on a day-to-day basis, and because of that, there may be times when it's easy to forget that there are people on the other side of the testing that we perform. Finding cancer, infections, chronic diseases, and life-threatening conditions have become a part of our everyday routine, and it's going to seem normal to us. But it will not be normal for our patients. A result we see all the time could mean a life-altering event for the person on the other side. And I'm willing to bet that all of us here have been patients at some point in our lives, whether it was something as simple as a routine checkup or something much more involved. And that means we all know what it feels like to trust our health to someone else. It can be a very vulnerable position to be in. And for most, it comes with a lot of questions. Did the doctor find something? Is something wrong? Is this treatable? Is this cancer? Will I be okay? And as MLS, we are in the extraordinary position to provide answers to these questions. With every test we result, we are giving people the answers and the hope that they have been waiting for. It is us that patients have entrusted their care to, and we must be committed to providing them the excellence that they need from healthcare. Because really, our MLS careers boil down to one simple fact. We make a difference. We make a difference in the lives of the people that we care for. And as long as we remember that, it will drive us to fulfill the demands of our careers to the best of our ability. And so, in the context of our MLS education, some may ask, why do you have to learn this? And here is my proposed answer. We have to learn this so that we can be exceptional at what we do and provide patients with the care that they deserve. Thank you, and congratulations to the class of 2017.